I have one idea that I think will capture dramatic market share for credit unions. It's ultimately a partnership between healthcare hospital systems, health systems, and credit unions that is focused on making healthcare more affordable and essentially presenting credit union offers to all patients. My wife works in healthcare, and the way I came up with this idea was actually listening in on one of her work calls. They were really focused on essentially the exact things that both its CDFI credit unions are so focused on, which is ultimately creating, now the idea would be healthier, wealthier, and more equitable communities, but greater outcomes for exactly the CDFI target population. So low income people and minority groups who generally have much worse health outcomes. I see credit unions as an incredible organization to help people with those problems. Got to think about how credit unions could work with hospitals to do that. And I think I've come up with a very, I'll just say what it is. So it's basically debt refinancing at the point of bill pay. So a patient goes into a healthcare provider. The healthcare provider allows an agent of the healthcare provider, in this case, this CUSO that we're launching, to run a pre-qual soft pull of their credit. We can then identify what loans they have with who, and you can model and figure out what their monthly payment is. And then we can run them through our field of membership decision engine and ultimately underwriting decision engine and figure out what credit unions would offer to refinance that person's debt at a lower interest rate and how much. So really what we're looking to do is like, how much can we save them a month on their other bills to make their medical bill more manageable to pay? Because if they can't pay their medical bill, then they generally don't do other preventative care. So they won't see specialists, they won't fill prescriptions, they won't come and seek additional preventative care after going and seeing a doctor. And the thing that credit unions will care about a lot beyond just the social benefits is 90% of people go through a health system each year. And so hospitals are terrible at accounts receivable and collections. And so we could take that off their plate. And part of the cost of doing that, basically hospitals will be paying to market credit union offers to basically the whole country. And it will be solving I've talked to a healthcare VC, and it's rare that anyone brings a top 5 problem for health systems to us. And this is definitely top 5, if not the number 1 problem that health systems are facing because of the Medicare, Medicaid. The social safety net is going away, and hospitals are really struggling to figure out how they're going to get paid for the services they're doing. And so if the patient portion, if credit unions can help hospitals collect more from the patient portion of bills, it will make a big difference to healthcare. And through the Affordable Care Act, what hospitals get from federal subsidies is determined on their outcomes. So if it actually does have the impact of changing the health outcomes of their patients, that will even have a greater multiplying effect for healthcare providers. I'm super excited about this. Yeah, and I've already recruited a incredible guy to be CEO of the company too. So it's going to be, I'm the credit union guy. It's going to be a product that we're selling to health systems. So the whole team will be like it'll be a healthcare facing company. And then the sort of special sauce on the back end is credit unions essentially.
And I think I heard you on the front end, you said it's a credit union service organization structure.
Yeah, yeah, definitely.
I've got a daughter who's a physician, and occasionally she'll share some stories without going into any specifics. But one of the things I heard you say was if they go in and they don't have the ability to go in for the follow-ups, they don't succeed. There are people who have all the money in the world who don't want to go back in and do the follow-ups, don't want to do what the doctor tells them. But if you put somebody behind the 8 ball where they have to decide whether or not they're going to feed their kids or go in for that follow-up exam, their success erodes underneath their feet because they'd go if they had the opportunities. I think that's an exciting venture you got going there.
Yeah, I'm very excited about that. That's the biggest picture idea we're working on right now. I think that could really change a lot.
Yeah, it's huge impact there. That's exciting.